All right, so say your name and professional affiliation.
Hey, I'm David Himmelstein. I'm a primary care doctor in Cambridge, Massachusetts, and an associate professor at Harvard Medical School, and I was one of the co-founders of Physicians for National Health Program.
Okay, you're a prominent supporter of single-payer system for the United States. Why?
Because it's the only thing that can actually make our healthcare system work, that can give my patients what they need and make my working life reasonably viable. We're facing enormous bureaucracy that inflicts ridiculous costs and crazy rules on us, and unless we take the insurance companies out of the middle of healthcare, the healthcare system can't work.
Are we going to see single-payer in the United States? If so, when?
I think we will. It's hard to predict exactly when. What we know is the more people fight for it, the harder they fight for it, the sooner it'll be. But the civil rights movement, who would have predicted that it was refusing to move to the back of the bus that would have triggered things? So we know that there were hundreds, probably thousands of civil rights workers trying to do things back then, and one of them took an action which triggered really an outpouring of sentiment. And our job for single payer at this point is to try and mobilize as many people to be doing as much as they can, and at some point one or more of those actions is going to have a galvanizing effect. We're already beginning to see it. There's more activity now than ever in my professional lifetime on this issue. Folks being prepared to get arrested in the Senate Finance Committee that kicked off, I think, a lot of attention. Hard to say when, but we know that there's sentiment and the match needs to be lit.
Now, you just came out of a meeting with Senator Baucus. What was your impression?
Well, we had the meeting because of the pressure that Senator Baucus is under. We had it because people were sitting in at his committee. We had it because people in his home state are screaming and yelling at him to do single payer. That's why he agreed to meet with us. I think that's clear. He admitted he made a mistake in not putting single payer on the table and allowing it a full discussion, but then he, in the next breath, said that it's too late to do that. So I guess there was some symbolic movement that was made, and that's good, but not nearly the kind of movement we need. We need to ratchet up the pressure much more on not just him, but other members of the Congress and the White House if we're going to actually make progress.
He has questioned whether the polls are correct that the majority of doctors and majority of Americans support single payer. Just your sense, aside from the polls, what the sentiment is towards single payer.
I think it's clear from the world I live in that most doctors are really ready for single payer national health insurance, and I speak to physician audiences all over this country of all kinds. I speak to surgeons, who are generally some of the more conservative elements of our profession, and get a very, very sympathetic hearing for single payer. I got a call yesterday from an orthopedic surgeon who's retired in a very conservative part of the country, and he says he's ready for single payer, and that's an everyday occurrence now. The medical profession is disgusted with the healthcare system we're forced to work in and ready for change, even very conservative members of our profession.
We heard said that it's the money that's blocking single payer, the insurance industry. Is that too glib an explanation?
No, I think that's exactly correct. I mean, the insurance industry is, we're going to put them out of business. And they make $30 billion a year in profit somewhere around there, and they're prepared to use as much of that as necessary to protect their business. It's not just them, it's the drug industry. They'd have to actually give reasonable prices on drugs to the American people if they faced a single-payer system. It's the medical device makers, and it's the for-profit hospitals and nursing homes and dialysis makers, because they're ripping us off. We're paying high prices for substandard care to those institutions, and they're in trouble if we had national health insurance.
Last thing. So President Obama said in 2003 that he's a single-payer supporter. All we have to do is take back the White House, the House, and the Senate. The Democrats did that, and now they're not favoring single payer. So what's your explanation for that?
Well, I think that the president is, I want to say, opportunist in the positive sense of the word, and that is that he's prepared to bend to our will if we can make it an overwhelming show of political might. And at this point, the political might is against us, and that's what he's bent to. And I think that we can bend the president the other way, but he's not going to lead, he's going to follow.
Thank you.